Plantar fasciitis is a common foot condition that's often misdiagnosed. You may be feeling plantar fasciitis if you're feeling pain on your heel, especially first thing in the morning, and it usually involves inflammation and/or degeneration of the tissues along the bottom of your foot. But how do you know if what you're feeling is actual plantar fasciitis or if it's something else? Well, hit that like button, stay tuned to find out. If your doctor has not been able to diagnose your plantar fasciitis properly, it's going to be hard to get the correct treatment. There are several different things that are going to mimic the symptom pattern of plantar fasciitis, things from heel spurs to posterior tibial tendinopathies, and we're going to talk about those in this video. I'm going to show you the 5 top differentials for plantar fasciitis to help you figure out if that's what you've got going on or if you have something else. So let's look at the first differential, and that is Achilles tendinopathy. The old word for it is Achilles tendonitis. So the Achilles inserts right here at the base of your heel. Now, we commonly feel pain a few inches above that, 2 to 3 inches above that heel bone, but insertional Achilles tendinopathy, the pain is felt right at the heel bone. Now, plantar fasciitis is often felt right on the inner bottom part of the heel. So those pains are very close. And if you don't have this picture of anatomy of the foot in your mind, you may think that you have plantar fasciitis when actually you have Achilles tendinopathy. The treatment for Achilles tendinopathy is similar but slightly different than the treatment for plantar fasciitis, so we need to be really accurate with that diagnosis. The second differential is posterior tibial tendinopathy. So this is the tendon from a deep calf muscle that runs along the inner part of your foot and attaches to the navicular bone right there. And so this pain point, again, is very similar to the pain point of where the plantar fascia attaches. And the treatments are going to be similar but slightly different, and we need to know exactly which structures are affected. So one of the main things we're doing for plantar fasciitis is manual therapy of particular calf muscles, but the posterior tibial tendon is going to direct that manual therapy to slightly a different location. So we need to be really accurate at finding out exactly where the points of pain are. The third thing that can happen that can make you think you have plantar fasciitis is a stress fracture. And those typically happen along the long bones of the toes. And it's going to be painful and weight bearing, and you may feel the pain anywhere along the bottom of the foot. And so, we Google search pain on the bottom of the foot, and of course the first thing that pops up is plantar fasciitis, but we do want to rule out stress fracture. The way to do this, gold standard would be an MRI. If you are going to do an x-ray, it can show up on x-ray, but it can take a while to see the changes because it's not a full fracture, it's a very small fracture. It can take a couple of weeks for it to show up. So if you do an x-ray and it's negative, you need to do another one 2 to 3 weeks later to really rule out a stress fracture. The fourth thing that mimics plantar fasciitis is tarsal tunnel syndrome. So there is, not shown on this model, there is a small band of tissue called a retinaculum. It's basically like a bracelet made out of tissue that wraps right through here, and the posterior tibial nerve dives right through that. And when that tunnel gets tight through inflammation, through muscles pulling tight, through joints not moving properly in the foot, that's going to squeeze down on that nerve and create pain on the bottom of the foot. Treatment for tarsal tunnel syndrome is going to involve taking pressure off of that nerve generally. So that may mean a variety of things from taping, supports, bracing, adjusting, manual therapy. And we want to make sure we've got the right diagnosis so we're not heading off in the wrong direction. The fifth diagnosis that gets confused with plantar fasciitis is a heel pad syndrome. So there's a fat pad underneath the heel bone, and over time that can become inflamed, it can become displaced, atrophied, and it can mimic pain at the bottom of the heel. Depending on what's causing the fat pad issue, treatment might include taping, bracing, supports, exercises, changing your footwear, manual therapy, and other supportive therapies. Hopefully this clears up what is plantar fasciitis and what is something else. If you have any questions, you can leave them down in the comments below. If you want more information about plantar fasciitis treatment, you can subscribe to my channel right over here. And there's another video right here that you might be interested in as well. All right, thanks for watching, and we'll see you on the next one.